Hi everyone, this is Dr. Rebecca. I want to talk a little bit about Syria from a global health perspective, but before I do that, I want to introduce myself because some of you may not be familiar with me at all. Some of you may know me very well. I'm posting this video in a lot of different locations, and I'm connecting it back to my 12 days of data challenge that I'm doing right now in terms of global health and some of my other global health data initiatives as well. So before I get into the main course of Syria from my perspective in global health, I wanted to take a moment to just kind of talk a little bit about myself and why I wanted to talk about Syria. So, my name, as I said, is Dr. Rebecca Fine. Part of my branding is to be Dr. Rebecca. That's how my Amazon, Roku, and Apple TV show was presented. It was an everyday science with Dr. Rebecca and friends, talking about things like this and other things related to COVID at the time, because I wanted to make sure that I provided an opportunity for expertise to be shown, not only from myself, but from other people who I know and I respect. And also because I think that the public needs to have a better understanding of what we do in global health and with data. So with that said, my undergraduate degree ultimately is from Hope College. I focused on Eastern European and Russian studies as much as I could related to my political science degree. So I am not a Middle East analyst. So my opinions here are not going to be from a political standpoint for that reason, but also because I think that we need to give the Syrians some time to sort out who and what they're going to be doing, although I will mention the Kurds very briefly when I get into my discussion of Syria. So, um, undergraduate, as I said, is from Hope College. I do have an MBA from University of Phoenix and a MS in Applied um, Healthcare Informatics from Bryan University. So I have two different healthcare degrees. My MBA is Master's of Business Administration and Healthcare Management. My Master's of Science is in Health Informatics. I did that because I wanted to really focus in on the data. I found that I loved data, and I've spent most of my career actually in laboratory data, so laboratory informatics and also in public health informatics. So it's kind of been an even split. Um, anyway, I did my doctorate in global health. It's actually a doctorate of health sciences with an emphasis on global health at AT Still University, and there's lots of reasons that I chose to go to AT Still. But my doctoral focus for my research was on mitigating um, vaccine preventable diseases in refugee populations using GIS, which is Geographic Information Systems, and other technology as appropriate. And there is a lot of information out there to draw from. And I looked at several different diseases and several different populations, and Syria is one of those populations. So, very briefly, for those of you who want to learn more about global health data, I want to encourage you to join my group that I've just started. I believe we have not hit 100 people yet, so it is still free, but the subscription to it will be minimal when I do add the price to it, because it's really my labor of love. Like, I really just want to share my passion and to help create a better world, better opportunities for my colleagues in the field, mentorship for those who want to get into the field or who just want to understand the field. And I just really want to hold that space because to me, Ubuntu is a very real thing. So, having said that, I want to go ahead and now talk about Syria um, from a global health perspective. And also, one last piece, who am I and why should you care? As I said, I have my doctorate in health sciences, specifically focused on global health. I do have a childhood friend who was murdered in a genocide. My father was born a refugee. My grandmother was a pregnant refugee evacuated by the Flying Tigers during World War II with 3 small children while she was pregnant with my father. So when you listen to some of these numbers, this is some of what I think about when I do my research. I am not going to talk a lot about other refugee data. I'm going to keep this very focused, but this is part of my motivation for doing this research. So, one of the things that I wanted to talk about was in 1963, Bashar al-Assad's father, I believe his name was Hafez, led a coup. And then he led Syria from 1970 until 2000 when he died. After that, Bashar al-Assad, who I believe is the youngest son, took over from his father. And of course, we know that this has been an autocratic state. It's also been a failed state because in 2011, they had protests against the Syrian regime, which then the regime cracked down on. And when the regime led this crackdown, this kicked off this civil war. And I don't want to talk about the politics of this because I do think we need to let the Syrians shake it out themselves. I do know, as I said in my earlier post, when we have a power vacuum, we often have more extreme elements take over. So I pray that this is not the case and that the Syrians can find their way through this, including people like the Kurds, who are stateless people. So when we talk about stateless people, these are people who do not have a nation state. So they have no citizenship. It's a very odd place for people to be, and it's very dangerous because you have no government at all. And there's lots of reasons that happens. And again, that's not the purpose of this discussion, so I won't get there. But anyway, another point about why you should care is that forced migrations continue to rise, and these migrants need medical care. This is especially scary if you are a clinical care provider in the United States. And by clinical care provider, I mean somebody who is a practitioner of clinical medicine. So if you are a physician assistant, a nurse practitioner, any of these disciplines and then some, right? Because there's lots of clinical disciplines. If you are a clinical practitioner, this is a very scary process. And this is because conflicts destroy infrastructure, including healthcare data systems and healthcare systems. And it is next to impossible to get those medical records from failed states. And it's also difficult because these consequences can be seen generationally. And you heard me talk a little bit ago about my father was born a refugee. My dad had bad teeth all of his life. But if we think about how biology affects, right? Like we know with epigenetics, and we know that my mother's mother, right, also carried me at some level because women are born with all of the eggs that we're ever going to have. So if we think about this, for example, for my cousins, right, my grandmother was a refugee and she was carrying, right, other generations with her. Also, if you get a bad start in life, sometimes you have a bad start in life, and there's other things that can factor into that. Of course, my grandmother was not pregnant with a girl at the time. It was my dad that she was pregnant with, but same principle applies. Another aspect that I wanted to bring out of this is that prior to the Syrian civil war, there was 91% vaccination coverage for things like polio. And in 2014, it was 45%. And this shows the power of vaccines because, of course, polio is in resurgence in Syria, which is terrible. And I don't wish that on anyone. There's no reason for polio to be in resurgence anywhere. Forced migrations, such as what's happened in Syria, also are very impactful to the rest of us because we know that as people move, so too do diseases. Diseases don't respect national boundaries necessarily. And also what happens is citizens are afraid to go outside, so they're not going to get their medical care. And then you also have your healthcare workers flee. And when your healthcare workers flee, you don't have people to run these vaccination programs and other services. And so those essentially stop. So another issue we have in Syria is because of the fighting in Syria, 40% of the ambulances and 57% of the hospitals were destroyed by the fighting. So where are you going to go to get care, and how are you going to get the care if you don't have that ability to have somebody see you? It's really scary, I think, on both sides of this equation. So a little bit about Syria. 1.5 million people are in need of assistance. 6.8 million are internally displaced. I'm going to talk about that in a second too. And there's 5.2 million Syrian refugees in the world. So what this really represents is 27 million people who may be receiving care in unfamiliar circumstances and settings, or may not be receiving care at all. And before I tell you guys a little bit about what an internally displaced person is, I just want to discuss a second that we are now living in a time where we have more than 100 million displaced persons in the world. And in 2021, 1 in 78 people on the planet were forced to flee their homes as part of a forced migration. Today, as I'm speaking to you at the end of 2024, that number is 1 in every 69 people. And what that means for my colleagues who provide patient care is that 1 in 69 people may or may not be receiving care that meets their needs, which is very scary. And of course, not why people go into clinical medicine. So, we also know that diseases kill more than violence during conflicts. So, I want you guys to think about that as we think about global health data and what we can do with global health data to create better outcomes during these crises. So now I want to talk a little bit. Internally displaced persons are persons who are still within their national borders, but are displaced. So they had to flee, but they're still within their country. A stateless person is somebody who doesn't have a state, like we were talking about the Kurds, who I hope will get a seat at the table for Syria and its restructuring and what it looks like now. You also have other people like the Rohingya are stateless people. And then you have refugees and asylum seekers. So refugees flee their country of origin for lots of reasons, and then asylum seekers seek asylum in a new country. So not all refugees become asylum seekers, but all asylum seekers started out as a refugee. So these are important distinctions. So I want to thank all of you for listening to my mini lecture on Syria from a data perspective today from Global Health Data. Please, if you haven't done so and you're interested, click the link to join my group. As I said, it's free to the first 100 people. I think it's still free. I haven't checked lately to approve more memberships. But do make sure that you join quickly because we are moving closer to that. And I just wanted to put this out as a little tidbit to help people because I'm getting lots of questions now about Syria. So thank you for listening to me. And I hope that Syria can put itself together in a way that makes the world and the Syrian people a little safer. Till next time.